Omicron is no worse than other variants, WHO. But additional study is required to determine its severity, according to senior WHO and US experts who spoke to AFP. Meanwhile, dozens of countries have had to reimpose border controls as a result of the severely modified version, raising the prospect of economic sanctions. Omicron may be more contagious than earlier strains, but it is unlikely to be immune to vaccines, the WHO's second-in-command said AFP on Tuesday. Preliminary results do not suggest a worsening, but additional study is needed, said WHO Emergency Director Michael Ryan in an interview. Ryan also suggested Omicron couldn't entirely circumvent current COVID vaccination precautions. Since Omicron's spike protein has more than 30 changes, Ryan conceded that current vaccinations may not be as efficient as they might be against this new strain of virus. According to early indicators, Omicron was not worse than previous strains, and may even be gentler. Fauci told AFP that the new strain is significantly more transmissible than Delta, the existing worldwide dominating strain. He cautioned against overinterpreting the results since the populations being monitored were young and less likely to be hospitalized. Severe illness might develop over weeks. An increase in COVID infections throughout the globe has been linked to the initial Omicron cases, which has fueled fears of an international outbreak. Norway stated Tuesday that it would strengthen restrictions to tackle the increase as EU health ministers convened to coordinate their reaction. A possible Omicron epidemic last week among hundreds of vaccinated partygoers led to increased restrictions in and around Oslo. Sweden announced anti-COVID legislation on Tuesday. From March 1, healthcare professionals, teachers, and military personnel must be vaccinated. However, the variant's appearance has underscored that the pandemic's struggle is far from ended. To combat the sickness, scientists and health professionals agree immunizations and social isolation are important. It's not only disinformation and conspiracy theories, but also the economic and logistical effect of such regulations. The Belgian government plans to make immunizations mandatory for health professionals starting early next year.